up with today's health headlines. Measles is at its highest level. Tick bites have caused a spike in ER visits in the Northeast, and AI is now reading echocardiograms in just minutes. Joining us is Dr. Arjun Venkatesh, Chair of Emergency Medicine for Yale School of Medicine and Yale Medicine. Nice to see you once again.
Hi, Elsa. Thanks for having me.
Of course. So this is alarming, talking about measles and how cases have really risen to the highest level since the disease was eradicated. What does this mean?
People don't know this, but back in 2000, we made a national declaration that we had eradicated measles in the United States. Unfortunately, this year we've got almost over 1,200 cases across the country as reported by the CDC, which is an all-time record since then. It means that we may not be able to any longer say that measles is eradicated. And it's really because we've dipped down below that magic number of 95% of people being vaccinated for measles, particularly amongst young children. Kindergartners, we're seeing a real decline in vaccination rates for measles. And so hopefully we can pick those vaccination rates back up again and prevent this from spreading any further than the 20 or 30 outbreaks we've had around the country. But it is a new record and not a good one.
And just as a follow-up question here, Doctor, how are you as a physician and your team encouraging people to get vaccinated, have their children vaccinated when that's not something they believe in?
There's a lot of different reasons why people may be hesitant to get vaccinated. And so what we try to do is really understand where people are getting their information, what's driving that decision, how do we help them understand the science behind vaccinations. These vaccines are remarkably safe. There's a lot of myths and misinformation out there. If you read what you get on social media, you're probably going to get led astray. So talk to your healthcare provider, talk to your pediatrician especially, and they are going to be really good at reassuring you, helping share the science with you, and show how you can really keep your kids safe by getting them vaccinated.
Good advice. Let's talk tick bites now. Unfortunately, you guys have seen a spike in emergency room visits. This is a national problem, you could say, but a lot of it happening here in the Northeast. So what should we know about ticks right now? A lot of people obviously spending time outdoors.
We're famous in Connecticut. We are home to the naming of Lyme disease. And in many ways, we've always been dealing with the tick problem. The data right now, though, seems to suggest that we have more ticks out there this year than in prior years, and that we're at a real peak this current tick season. I've lived in Connecticut for 13 years, and I got my first tick bite a couple weeks ago.
Wow.
And my kid did as well. And so I know how it can be distressing. The important thing is to know this. We have a lot of ticks out there. Use bug spray, insect repellents, whatever it might be that you use to prevent those tick bites. And if you do get a tick bite, the important thing is to get it off early. If you get that tick off within the first 24 hours, we know that the likelihood of getting something like Lyme disease or other tick-borne illnesses is exceedingly unlikely. And then contact your healthcare provider. Figure out if you need to take any medication. If you've got signs of a tick-borne illness like a rash or something like that, talk to your doctor.
Yeah, we always talk about the importance of doing self-exams, body exams, everything. So it's a good reminder to do that as well after going inside from spending time outdoors. Let's talk now about this Yale study that found AI, a new tool, can read echocardiograms in just minutes. Is this a good thing for doctors and patients? We hear a lot about AI, and a lot of people, don't know enough about it.
I think we hear about AI everywhere you turn these days. And this is really well done research that came out of some Yale researchers in cardiology who were looking at echocardiograms. Those are ultrasounds of the heart that are done in the emergency department. And we do these routinely. Thousands a year of these are done. And what they found is they could train an AI tool to look at all of those pictures, probably in ways that the human eye can't even look at them, and figure out if there's some critical diagnoses on these ultrasounds. This is the kind of way in which AI is going to help doctors take care of patients and help read all these echocardiograms and these ultrasounds even faster. And so if you've had to wait days or weeks to get one of these echoes, these are the kinds of technologies that are going to make it faster and easier for you to get those scans done and get accurate results.
Well, that is certainly encouraging. Thank you so much for your time. Nice to see you.
Thank you.
All right.